Next, we are going to deal with not a respiratory ailment, but it is sinusitis. Sinusitis is very common these days, especially in small children and students. Sinusitis is common. It's due to the lifestyles. I'll talk about that later. So, what is sinusitis? Sinus is the nasal cavities, which is causing the mucus inside the nose. So, the paranasal sinuses are getting inflamed in the case of sinusitis. So, we have water accumulation inside, and that can cause symptoms like runny nose, etc. So, symptoms we'll talk about later. So, there are two kinds of sinusitis, acute and chronic. So what are the reasons? You can get sinusitis from the family. It's again genetic. Then you can have maybe allergic reactions and kind of infections which you are not taking care of. Autoimmune diseases. Autoimmune is that when your immune system attacks you. This is one reason for sinusitis. So there are two kinds of sinusitis. I told about that, acute and chronic. So acute is you cannot distinguish it with the symptoms. Symptoms are almost the same only. But the thing is that acute sinusitis, if you are treating it properly, if you are going okay with your lifestyles and all, you can arrest it in 1 month. 1 month is a maximum. Then other one is chronic sinusitis in general. It's not exactly scientific. Another one is there subacute, but generally if the sinusitis symptoms are like prolonged over 4 months, then it is chronic sinusitis. Now the symptoms of sinusitis and how we can distinguish it from common cold. Common cold is actually viral. It's mostly viral. But symptoms are like in cold you will have just normal running nose and maybe some headache due to the temperature only. And it will not go about like 4 weeks. Maximum is 1 month. It will not go about 1 month, above 1 month if it is cold, or maybe 2 weeks, 3 weeks like that. And the symptoms are like in sinusitis you have greenish or yellow thick discharge, and you will have blocked nose, and you have some tests to identify that. I'll talk about that. Then you can have the headache and even upper teeth issues, teeth pain, upper jaw pain, and the pain over the local tenderness over all these areas, and you will have congestion and fever, and even fever can be there, and it's based on time, as I said already. So what are the how can you test it? How can you examine a patient or a person? If you want to know if it is sinusitis, you can test it. There are some ways. So it is tenderness. Touch it, palpate or percuss. Palpate is like giving pressure over the area or touch, and percuss is doing this. So how can you, what are the places? Which are the places? So sinusitis are like you can divide it into frontal, etc. We don't need that. We just have to know about the areas. The first area is here, upper area, upper eyebrow. Just touch it or pressure, give a pressure, that is palpation, or percuss it. You might have tenderness, like normal people won't have that. Then the place is here, below the eyebrows, the place near the eyes, this is one place, one area. Give pressure or percuss. You wouldn't have normally, you wouldn't have any pain, but otherwise you will have tenderness. Then this is another one, nose. The upper part of the nose, give pressure. Then other one is the lateral eminence of this one, the canine eminence. This is the eminence here. So lateral portion of that, give pressure or percuss. Look, I'm very normal. Nobody is having pain here. Otherwise, if you have sinusitis, you will have tenderness and some congestions and all. This is the area. These are how, another one is normal respiratory. You can close one nose and inhale. That is common for cold also. So these are generally how you can identify sinusitis. You cannot really arrest all kind of respiratory disorders, but you can take care. So for that, I told about how to take care of breathing disorders and even cough and everything. So for that, we have some products like Siddha Magardhwaja is very helpful to arrest the acute symptoms of asthma. Or you can Vashaka Valeha, which is good for cough and all. Then you can use Purna Chandrodaya Rasa. This can help you with rejuvenation from inside. Then Dashamula Ashta, Amrita Ashta, all are helpful. Or you can use one product is there, it's a cough syrup and it is good for asthma and all kind of ailments. This is Shwasa syrup. You have the dose and everything in the cover page itself, and you have the ingredients in here. It has all ingredients which is good for cough, like pipili, tulasi and pepper and everything like that. You can just go through the product. So this is one product here. Then about the sinusitis, what you can do is your lifestyle. If you're getting a genetic and immune related, you cannot do anything really. You just have to go to treatment. So regarding lifestyle, avoid everything which is cool, even cool bath. Cool water bath, even including fruits and fridge water, everything. Then avoid head bath, frequent head baths and night baths. You can avoid that. Then you can drink. You don't have to use fridge water always. You can use some kujas or copper or bronze vessels. You will get cool water, which is very healthy. You would not have things like accumulation of water inside your head and everything. So what for sinusitis? Again, Amrita Dashamula Amrita is very good for sinusitis, and you can go and visit an Ayurvedic physician. So if you want to buy our products online, you can visit wonderherbals.com.